Climb on in. We going live tonight. But listen, on today's live at Higher Levels with Shay, y'all know I'm a bachelor's degree registered nurse. I just got in. We had a busy day today, but I wanted to still tune in as I discussed with you all. Now, this is a very important topic, okay? And I really want y'all to be engaged and tuning into this topic because we're going to talk about being a patient advocate for yourself. We're going to talk about healthcare disparities and everything that's going on with the healthcare. If you feel like you've been dismissed, we have questions that was a direct message to me that I'm going to address. Some of them are anonymous and others actually left their names because they, wanted to be transparent. And so we're going to jump into these questions and I'm going to answer anything you guys want me to answer in regards to the healthcare field, okay? So y'all can ask me questions about how to be a patient advocate, ask me about just different laws and rules and regulations when it comes to healthcare, or y'all could just ask me something personal in which what you're going through or what you yourself have experienced. So this particular topic is very important to me because in all of my years in healthcare field, especially more so recently, what I've been noticing is a lot of people are coming into the hospital, and particularly those who do not have private pay. What they're doing is they're being kind of like dismissed and they're being rushed out of the hospitals because let's face it, it's about money. And what I tell those patients when I see it is you have to be a patient advocate. I tell them what questions to ask the doctor. I tell them how to stand up for themselves, how to demand certain labs being drawn and certain diagnostic studies being done on them to make sure that they get in their holistic care before they leave those hospitals and those physicians' offices. And so for me, I want to just touch on this topic with you all on here and get your feedback. I want you to be engaged, okay? So let's talk about it. Let's talk about it. So I had a question and I got them written down here, but I had a question, right? And one of the questions somebody asked me in a DM, and it says here, this girl is Jessica P from North Carolina. So Jessica P from North Carolina asked me, she says, Shay, what do I do when I went to the doctor? I've been telling them about my chest pain, but they keep telling me to take an ibuprofen and telling me not to stress about it. They also told me that it can be due to my breast size. I am beginning to be concerned and I'm tired of being dismissed. This is the third doctor I've been to. What do you suggest? Okay, and see, that is what I'm talking about right there. So you have this patient, Jessica, who's went to the doctor and she's complaining about chest pain and she's been dismissed, and they told her that it was due to maybe her breast size. And what I would encourage you, Jessica, because I know you on this lab right now, you said you was going to be here. What I would encourage you to do is first and foremost, when you go to the doctors, the first thing you're going to do is give them all of your signs and symptoms. Tell them everything that you've been going through. Thank you for the lights. Everything that you've been experiencing as far as your signs and symptoms. Tell them, when did it first start? When did your signs and symptoms first begin? Then you're going to ask them, how long has it been going on? How long has you been having that chest pain? Tell them what activities that you're enduring that helps relieve your chest pain, and that also causes your chest pain to be more severe. Those are some of the questions, some of the information that I want you to talk to your doctors about first. Secondly, if your doctor or primary care physician isn't asking you about your diet and about your activity levels, I would immediately go and get a second opinion and go see a new physician, because that should be the next question they ask you is, how's your diet? How's your activity levels? And what is your family history? So I don't know if you were already asked these questions, but if you were, great. And you have to be transparent about it. If you were not asked those questions, then I would tell you to go get another opinion and go seek another physician. Secondly, you have a right to ask them to draw your blood. They must draw your blood. Look at your cholesterol levels. Look at your red blood cell levels. And when I say cholesterol, your LDL, that's your low density lipids. And your HDLs, your high density lipids. You be a patient advocate for yourself. You also make sure what you tell them, and this is what I tell everybody. Let them know that you do have an attorney and that you discuss your attorney. Don't say it in a threatening way. you could just be like, you know, well, I discussed this with my attorney as well, and he told me that I should be able to, that I should be getting some more diagnostic studies done. This is my 5th time being here. I do have them written down in my calendar. This is my 5th time being here, and I'm noticing, you know, that I'm not getting any results. And then make sure that you keep documentation of who's seen your care, who had involvement in your care, who were the physicians or nurse practitioners that you've encountered with, and what day and time you actually had that conversation. So when they know that you are keeping record and they know that you are documenting things, they're more receptive to making sure that they're adhering to your care, okay? So you're going to go in there and you're going to let them know that what happened on your last doctor's visit did not help. It didn't help you at all. It did not alleviate your pain. You're still having that significant amount of pain or discomfort. So next, I would encourage you to do is make sure they not only just your blood work, do some diagnostic studies like an EKG or an EEG. All right. So an EKG and an EEG, that is like an electromagnetic study test that they do, and they place like electrodes on your heart, and it shows the rhythm of your heart, exactly if your heart is pumping and functioning properly or improper. And your lab work, such as your potassium and your magnesium and your sodium level, all of those things are going to be on your test results. So if your electrolytes are imbalanced, it can lead to chest pain. She said, I'll get a placement when you're ready. What do you mean get a placement? Like a heart, like a stent? What do you mean by a placement? So that's just what I would tell. That is something that I would tell you, Jessica, is how to be your patient advocate. Write down, document exactly who you're talking to, the days and time you spoke to them, exactly what it was they did for your care, and be very, very, very intentional about the details that you convey onto them so they can make sure to give you the holistic care. So that is one thing that I would absolutely, absolutely say. Secondly, it doesn't hurt to get a second opinion anyway. So make sure you're getting a second opinion regardless, okay? Thank y'all for tuning in. If y'all just now tuning in, we talk the healthcare field. I'm a bachelor's registered nurse, 15 years in the medical field. And today our topic is just open Q&A, open discussion, open questions. Usually we only talking about a certain disease process like herpes, HIV, diabetes, heart disease. We usually talking about those disease processes, but today I wanted to keep it simple and just talking about how to be a patient advocate for yourself and not going into the doctor's office and allowing the doctor to just dismiss you because of whatever reason that they do it. Now you do, full disclosure, you do have some amazing physicians, amazing nurse practitioners. I definitely want to make sure I say that because there are some great ones out there that are very thorough and that I've had the pleasure of working with and I had the pleasure of being treated by. And so that's what I want to encourage you to do. Let them know you have an attorney. Let them know you've been documenting everything, and then be very transparent about what it is that you're going through so they can know exactly how they can, tend to your needs. Ask for those tests. Ask for those diagnostic studies. And yes, you have a right to your reports. You have a right to your reports. All right. Do I have anybody who want to comment or ask me a question before I go to this next DM? I have about 5 DMs, so that's why I'm going to jump on here. I thought it was going to be quick, but you are more than welcome to join in. You're more than welcome to be a guest and join in on this live. So if you yourself have encountered you going to a physician's office or going to the hospital and feel like you've been turned around, and this is very pertinent for us to talk about this right now because the pandemic is going to be back. We're entering into flu season, and I'm here to tell y'all now that the numbers are already increasing, but the CDC isn't allowed to, well, they're not going to publicize everything yet until it reaches a certain number. So until the number of cases reach a certain number, they're not legally obligated to inform you. You see what I'm saying? So with that being said, I want you guys to take necessary precautions and making sure that you are giving yourself the most, Detox, 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 and give yourself a chance to build your immune system so that you can make sure that your immune system is strong enough for this new upcoming pandemic that's, you know, this up and coming flu season, okay? So somebody said, can I talk about blood pressure? So you want me to talk about blood pressure as in how to lower it, the causes of it. What do you want to talk about? We're talking about blood pressure. You want me to talk about herbs that help to decrease blood pressure? Have you yourself encountered anything with the physician where you went and asked for help with the blood pressure and you've been denied or you've been neglected? Elaborate a little bit because I will absolutely touch on blood pressure. So I'll give you a moment to type in, and do understand that we talked about blood pressure, cardiovascular issues. We talked about diabetes. We talked about dementia, autoimmune disease, kidney issues, digestive issues, dementia. We talked about reproductive issues, both men and women. We've discussed so many different labs, and those labs can be found on my YouTube channel at Higher Levels with Shay. Higher Levels with Shay on YouTube. So I am here to be your internet patient advocate, but I need you to be your own advocate. So you're going to take this information I'm telling you about and then inform others. So elaborate more on when you ask me about blood pressure so that I can know exactly how to address your issue, because I definitely want to know. And I'm going to tell y'all a little story here, and I want y'all to hear this story, right? So there was this patient, and I think I talked about it on one of my lives before. And she was a 26 at the time, year-old patient. And she found a lump in her breast. She found a lump in her breast. And because she was 26 years old, they said that her insurance wouldn't cover a mammogram and that they weren't concerned about breast cancer. Well, she went to the doctor not once, not twice, but 5 times between the ages of 26 and 28. She went 5 different times and was expressing to them about the lump in her breast and that she began to have discharge from her nipples. Now, if y'all remember on my last live, well, when we did cancer, we talked about women when you are doing your breast exams. If you squeeze your nipples and you have discharge, that is a bad sign. If you feel a lump, you must go in immediately and go get yourself checked out. So what food to avoid and what can I get rid of? Okay, I'll tell you. I'll answer that, Nakisha. So what happened was between 26 and 28, she went to the physician's offices. No one did a diagnostic study on her. No one did a mammogram on her. And so what happened was at 28 years old, she was diagnosed with stage 3 breast cancer at 28 years old. And it metastasized. And metastasized means that it moved to another place. And so by that point, it spread throughout her body. And needless to say that chemo and radiation and even oral chemo medications was not going to suffice to help her sustain her life. So she did perish, unfortunately. And this is why I'm on here doing this live, because that was about 2 years ago. And we're pushing for the insurance company and for the medical community to start allowing for mammograms to be covered on insurance no matter of the age, because in the times in what we are living in now, cancer is becoming more and more prone. Cancer is becoming more and more common because of our environment and because of the life that we're now living. Life has evolved, and so telling someone to wait until they're 40 or 45 to be able to get a mammogram, that just isn't realistic in today's time. And so things such as that is the reason why I get on here. And I said today going to be a regular Q&A session. We don't have a specific topic like disease process that we're talking about today. And if y'all remember Tuesday when we was going over, what was we going over Tuesday? It wasn't blood. We did the blood types. I think Tuesday we was going over herpes, HIVs, chlamydia, gonorrhea, and we gave away herbs and natural remedies on how to heal yourself from herpes and HIV and AIDS and all that stuff. So we did that Tuesday, and we said that we was going to be here live today just for open Q&A. So Nakisha has a question. She says, what foods to avoid and what can I do to get rid of blood pressure? So that's a great question, Nakisha. What you want to do is you want to avoid foods that are high in sodium. And by sodium meaning salt. That can be that can be fried foods, spicy foods, potato chips, noodles. I don't know if you ever ate the noodles and you have that pack of noodles. Anything that's high in sodium you want to stay away from when it comes to blood pressure. You want to stay away from processed foods. Processed foods meaning like your canned goods. Those are high in sodium. You want to stay away from saturated sugars when it comes to blood pressure, because if your blood pressure is elevated, then more than likely it can lead to a heart condition. And with the saturated sugars, you don't want to then, you know, have to worry about becoming a diabetic or having heart issues. Foods that I will tell you to and encourage you to eat is first and foremost garlic. Garlic lowers your blood pressure naturally. Naturally, garlic lowers the blood pressure. Onions, cilantro, celery, beets. Beet has a very potent taste, but if juiced correctly, like you could juice it with like strawberries and grapes and blueberries. Juice it with something a little bit more sweet. And these are natural sweeteners. This isn't artificial sugars. So juice it with something more naturally, and with coconut water. Coconut water helps as well. That helps to lower your blood pressure. Now, if you want to talk about herbs, greater burdock. Greater burdock, milk thistle. Those things are amazing for your blood pressure. Clover. Bloodroot, red root. Those things are amazing for lowering your blood pressure. So that is the advice I would give you, okay? Drinking plenty of water, drinking your water. So you want to talk about that for blood pressure. Those are some fruits and some vegetables and some herbs that I would highly recommend that you do some research on, okay? Especially the tomatoes. Tomatoes are amazing for the heart. As a whole, it is amazing for the heart. Cascara sagrada, that helps to cleanse your gut. And so that helps to kick on your detoxification mechanism. So Cascara sagrada. All right. That it helps cleanse your gut, cleanse the mucus off your gut. And you're able to detox more, and you're able to help your blood pressure a lot more. I mean, to regulate your blood pressure a lot more. But the number one thing that is really, 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 really simple is garlic. Garlic, garlic, garlic. So I highly recommend that. Pineapples are good for blood pressure. Pineapples are good as well. Fruit, I'm telling you, fruits, vegetables, and herbs. You're talking about healing yourself holistically. You're talking about just deep, like cleansing your body. Another thing that I mentioned on my live was the sun. Do y'all know that the sun breaks down the cholesterol and turns it into, help your body turn it into vitamin D. So even just getting out in the sun, it breaks down the fat that's in your blood vessels, and that's within your body. And so that means your heart isn't pumping as hard and it's able to relax a little bit more. But definitely stay away from like processed foods. Stay away from those deli meats. Those are really high. Stay away from ham, pork, red meats. Those things are smoking. What smoking does, if you smoke, I don't care what kind of smoke you do, but if you smoke, what that smoke does, it constricts your blood vessels. It constricts your blood vessels. Oh, no, baby. So it constricts your blood vessels and raises your blood pressure up even more. So definitely stay away from smoking, okay? Any more questions? Any questions? Y'all come on in and climb on in. Be transparent. Now is the time. Now is the time for y'all to ask me any question you want to ask me about the medical field. If you feel like you're not being heard, if you feel like you're not, like you're constantly going to them about a certain issue, then I need you to be vocal so that I can know how to help you in this situation. Then after that, I'm gonna go to another question that I have here. I have some people direct message me. Like I said, some anonymous, some are not. Foods to lower your A1C. So they talking about the blood sugar. So you talking about your glucose. So you must have diabetes, or you must be on the border of having diabetes. Talking about the A1C. So if you are diabetic, let's say you are diabetes type 1. Diabetes type 1, those are people who are insulin dependent. And thank you are so welcome, Nikisha. Then you got diabetes type 2, meaning that you could change your lifestyle and, you know, make sure your body is able to regulate the sugars and produce enough insulin from your pancreas to alleviate, you know, the high blood sugar. So, how to lower your A1C? Again, you want to stay away. Let's talk about the causes of it first. So, you want to stay away from, again, artificial sugars. You want to stay away from caffeine. You want to stay away from stress. We got to first talking about, okay, good. Thank you. Said, ma'am, it was a 5.5. So you are literally like pre-diabetic. You're pre-diabetic. So they're almost saying like you are on the border of actually being diabetic. And so in your case, what they would do is they'll put you on something like metformin or glipizide. Those are medications that you don't necessarily need insulin for yet. However, they're trying to prevent you from your diabetes from getting worse or your pre-diabetes from turning into diabetes. So that they do this to some people. You may not. What I would tell you to do is exercise. One, exercise. Do y'all know that if you exercise, and I don't care what kind of exercise you do, I don't care if it's swimming, it doesn't matter if it's running, it doesn't matter if it's you working out rigorously in a gym. If you exercise, your body is going to break down sugars naturally and turn it into energy. So, meaning that your blood sugar will then decrease naturally. You're also going to eat green apples. Eat green apples, and green apples. That also helps to lower your blood sugar. Again, greater burdock is amazing for lowering the blood sugar. So, research herbs. And somebody asked me, where do I get these herbs from? I always tell y'all about that website. Yafai Shakur, where you get those herbs at YAFASHAKOOR. So I'll tell you again, exercise, drink plenty of water, herbs. Be careful about the fruits that you eat though, because some fruits like raisins, they actually increase your blood sugar. So you want to be careful about the fruits, you know, that you eat. I would tell you to do is first to start off with green apples, and monitor your blood sugar as you're eating these certain foods. And if you notice that within an hour or two, your blood sugar didn't spike up, and within an hour or two you eating that certain fruit or vegetables, then that's something that you can continue eating. However, let's say you eating grapes, and we all know how sweet grapes are. So let's say you eating a grape, and your blood sugar is still elevated after 2 hours, then I would encourage you to stay away from grapes. See, so diabetes is a little different because the fructose and the sucrose that's in our natural fruits can cause you to have high blood sugar. My blood sugar is a 6.8. That okay? Your A1C is a 6.8, not your blood sugar, and that is not okay. That's actually higher than the normal range. So if your A1C is a 6.8, then more than likely you either on PO, by mouth medication, or you're on insulin. So that's not okay. That's actually really elevated. And for the women, if you are pregnant, you got to worry about something called gestational diabetes. And gestational diabetes means diabetes that you've developed or, you know, from pregnancy, okay? So you want to make sure you be mindful of what you're consuming as well. So, again, back to the original commentator who asked about his 5.5. What can he do to lower it? Change your diet, increase your exercise, and drink plenty of water. And remember, your exercise does not have to be rigorous. So the next time, I don't want to say it's not a cheat code, but the next time if you go and you're about to get your A1C checked, here's some fun facts. Exercise before you go, like an hour or two prior to you going. And 2, make sure you abstain from eating. Do not eat from midnight until let's say your appointment is at 8 a.m. Then make sure that you abstain from eating anything from midnight till your appointment. But let's say your appointment is at 2 p.m. Then you want to make sure the last time you've eaten is at least 6 a.m. That's the last time you hear, okay? He said, I hear that too much water is not good for you. Too much of anything is not good for you. Too much of anything isn't good for you. However, you want to make sure that you're still getting an adequate amount of fluids, because you want to make sure that you keep your pancreas strong, your cells strong, and you want to make sure that you're keeping your blood thin enough and your heart hydrated so it's not over pumping itself. Because like I said, I was telling a young lady earlier, what's your name? Bridget, I'm sorry. Like I was saying to her earlier, if you have a heart, like high blood pressure, very often you will see diabetes and high blood pressure together, like a heart issue and diabetes together. When you have a lot of blood, a lot of sugar in your blood, the same way it is sticky on the outside, you know how sugar is sticky? It's just as sticky on the inside. So you do want to make sure you hydrate yourself enough. And I always tell people to eat your water. Eat your water, meaning watermelon, honeydew melons. Eat your water. So you stay hydrated. Hi, my CT scan showed that I have compression of the left renal vein by the transverse duodenum. And then it cuts off. So what did you mean to say something more? So your CT showed that you have compression of the left renal. And she's talking to September. I don't know if you're man or a woman, but what they're talking about, they say left renal vein, they're talking about their kidneys. So you have arteries and veins in your kidneys. And so what she's saying is that there's compression on her kidneys from her transverse duodenum. And that's part of her digestive system. All right. That's part of her large intestine. So what she's saying is her large intestine is pressing on her kidney. That's what he or she is saying. And so you have an enlarged. So the issue is your GI tract. So you have an inflamed duodenum. What does it cause from? What do you have ulcers in there? Like, is it Crohn's disease? What is causing your duodenum to press on your vein in your kidney? So that's the next question that I would ask you. What is the cause? What is going on in that area? Like, is there a tumor? Is there a cyst? What is going on that is causing for your GI tract to be compressing onto your kidneys, which that can lead to a kidney issue, because ultimately what it's doing is cutting off the circulation to his or her kidneys, which is going to ultimately lead to kidney failure and issues with urinating and issues with the production of, not the production, but the detoxification of, the renal system. So you're supposed to be able to urinate. So I need to know more. I need to know more. What is going on with your GI? Why is it inflamed? Or why is there a tumor? What is causing for that to happen? It really bothers me a lot. But what is happening? See, this is what I mean when I say we have to ask the right questions. Because for you to have that CT scan, the CT showing that your duodenum is pressing on your renal, we know that that's something that's abnormal. You see what I'm saying? So there's no way your large intestine should be so swollen and inflamed that it is compressing a whole nother organ. You see what I'm saying? Or the circulatory system of another organ. So if I was you, my next question would be, why is this happening? What is the cause of this? Is there a tumor? What is happening? Why is that occurring? And how do we correct the issue? Because by a compressing on your kidneys, I'm sure you're going to have difficulty urine. You're more prone to having UTIs. You see what I'm saying? I'm sure you have a lot of abdominal pain. You see what I'm saying? Thank you all for the gift. So are you having like excruciating abdominal pain? Are you having pain in your back? Pain on your left side of your back? Meaning that you're having kidney issues? I need to know more of that. And I need you to ask these questions as well. You know what I mean? Somebody says she may have a stretch, that she could have a hernia. We don't know what is going on. So these are some questions that I need you to answer. So you answered yes, but yes to which one specifically? And if you don't know, I know you're saying yes to the signs and symptoms, but I need you to go back to your primary physician. Tomorrow is Saturday, and then now we're going into the holidays, so I'm sure they're going to be closed on, no. Oh, you saying she got a possibility of kidney stones? You can have a possibility of kidney stones, but before we get to that, the issue is the GI. The issue isn't the kidney. The issue is the GI. What is going on in her large intestine? And so when you call them on Tuesday, now you can call them or you can go to the ER tonight. and figure out what exactly is happening with you. She said, I have an appointment on Wednesday. And when you have an appointment, you be sure to write down exactly who you're speaking with. Who's your primary physician? Who's tending to your care? And you ask them the causes. What caused my GI to be inflamed? Your duodenum, that's your large intestine. Ask them what caused it to be inflamed. Could I see a GI specialist? Can you refer me to a GI specialist? What kind of signs and symptoms are you having? Are you having a burning sensation? Are you just having a lot of nausea? Is it a throbbing sensation? Is it an aching sensation? Are you constipated? Is it diarrhea? I need you to ask all of those questions. And I need you to be able to answer those yourself. Say, I'm having diarrhea. I'm having this. I'm having that. So they can know exactly what it is that is transpiring with you. So that you can, and let them know that you want further testing done. Because a CT is a CT. You may need an MRI. An MRI is a magnetic resonance imaging. And what that does is you're able to see your internal organs more specifically and give you a more detailed understanding of what's going on internally. So it's more effective than a CT scan. Okay? Now, on Tuesday's lab, oh no, not Tuesday. I won't be here Tuesday. Monday. Let's do Monday. So on Monday's lab, I want y'all to type in the comment what do you all want me to discuss on Monday. But today I definitely want to talk about this. I want to be completely open. And I'm going to get into this next question, because this next question is anonymous, and I understand why this person is anonymous. And I have to be completely transparent with, this is going to be a big one. This person is anonymous. She says that, hey, I don't want my name being mentioned, but I'm not a fool, so please don't judge me. But my husband, I got tested for STIs and my gonorrhea came back positive. He tells me that he's been faithful and he's refusing to get tested. He's telling me that it can come from yeast infections. I Googled it, but it does not say that you can get a gonorrhea from yeast infection. I'm not an idiot, but what are your thoughts? Okay, so before I get into this, can anybody help Anonymous out with this question? Does anybody want to help Anonymous out with this question? And Anonymous, if you on this call right now, thank you for putting in this question. It's completely confidential. It is safe for me. I will not mention anything. Does anybody have any advice in the comments first? Let's see what y'all think. So in here, she's got tested for STIs. She came back positive for gonorrhea. Her husband is refusing to get tested, and he's telling her that it comes from her having a yeast infection. Monica said he is cheating. She said that he says he's faithful. She says that he says that he's not cheating, but it came from her having a yeast infection. She Googled, and nowhere in there in Google could she find that gonorrhea is linked to a yeast infection. So what can we tell Anonymous about this topic? Dominique said he's lying, honey. I'm sorry. So before I answer, I need to know what y'all think. Rowan girl, do not say nothing. You got to say something. Dwight said no way. Okay, Anonymous. If it's not you, it's him. Okay? So you saying if she's not cheating, then he's cheating. Is that what you're saying, Dominique? Because I'm going to answer the question very transparent and extremely honest. But I want to see first what the audience has to say. Monica said go to the doctor with him. Well, she says right here, Monica, that she says that he's not. He's refusing to go because he's saying that it's coming from her yeast infections. Okay, so Dominique says exactly what I'm saying, that it's either her or him. Thank you for the gift, Ron. Love you. Thank you all for the gifts. Thank you all for the heart. So if no one else wants to tackle this with me, with her, I'm going to thank y'all for commenting. Dwight said he is guilty. All right. So, okay, here it is. Anonymous girl. 15 years in the medical field. And I have to be completely transparent with you with this. Like you said in this DM, you said, I'm not an idiot. So I feel like, honestly, you already know the answer to this question. But if you just need like validity and you just need confirmation, then you absolutely cannot contract gonorrhea from a yeast infection. You cannot. That is inaccurate information. You cannot catch any sexually transmitted infection from a yeast infection. You can only contract gonorrhea from sexual intercourse or sexual activity. And we I say intercourse because I was careful not to say just intercourse, because you can also contract gonorrhea from oral sex, anal sex. Okay. So if you tested positive for gonorrhea, then I highly encourage you to absolutely get tested, but you need to refrain from having sex with him until he gets tested as well. I'm not going to encourage you to leave your husband, divorce him, or anything. That's completely up to you guys. I'm going to stick to the question in which you asked me. But if you plan on staying with him, he has it as well. If you've been faithful, because I'm going to go back to what Monica said. If you haven't been faithful, then you have to look at your other sexual partners as well. If you've been faithful and you somehow, after all these years, contracted an STI, a sexually transmitted infection, then it's absolutely coming from your partner. And he's not wanting to go get tested because he knows that it's going to come back positive, and which is going to confirm that it was him who was cheating. So I don't want you to, and be thankful. See, somebody named TMH daughter said it's too much stuff going around. I can't believe people out here doing that, the same old stuff. Exactly. Thank you for that. And I was just getting ready. Thank you. And I was just getting ready to get into that. I was getting ready to get into that because be very thankful and grateful that that's all it is gonorrhea, and that it can be treated. And I will take this as a warning sign. And if I was you, I will take my antiviral medications. I will drink my water. I will take my herbs, and I will be speaking with a divorce attorney. Because like we said on Tuesday, if you were in Tuesday's live, which I think you were, because you DM'd me after that live. So if you were in Tuesday's live, then because we talked about gonorrhea, we talked about chlamydia, we talked about HIV, we talked about herbs to help cure those things. We talked about the viral blast T. We talked about all of that, how to cure yourselves of these disease processes and what herbs take to help alleviate your signs from herpes and everything. And if you remember, like we discussed in that live, untreated gonorrhea could lead to HPV, human papillomavirus. Human papillomavirus can lead to cancer. You see what I'm saying? And we also discussed that HIV, you can go undetected and it can lie dormant, and you can be asymptomatic of HIV for 5 to 7 years. And I'm not saying this to scare you. I'm saying to make you all aware. You getting tested for gonorrhea, understand that for the next 5 to 7 years, you absolutely should be getting tested for HIV as well, because ain't no telling what else he contracted. And I'm so sorry that you're going through this, and I wish you the best of luck, because that's a horrible thing to be faithful and you in a marriage and thinking that your marriage is sacred, and then you find out your partner is being unfaithful in this way. And he's terrible for you're not even protecting yourself. You're just out here it's just not good, and that's not okay. And so best wishes to you. Thank you for writing in. I appreciate you being transparent, and absolutely go get tested. He's being unfaithful, and you caught it from your husband, and he's caught it from whoever he's sleeping with unprotected, not even considering your life and what they can do to you. So that's not, please reevaluate that relationship immediately. I work at a pharmacy, and scripts for HIV has increased big time. Yes, because the rise of HIV is going up so significantly. Look at the numbers in Houston. It was like 40,000 cases that tested positive just this year alone in Houston. And then you got Georgia, you got North Carolina. I just did a live, an interview with someone what was it? Yesterday? We did a live. No, it was Wednesday. We did a live, and we was talking about that exact same thing. So, I mean, it is absolutely on the rise. And the scary part about it is people, as I was explaining in that last, if y'all seen that last live, that interview with Rush, it's on my YouTube channel at Higher Levels with Shay. So if y'all want to see that, go to my YouTube channel, Higher Levels with Shay. But in that lab, we talked about HIV and we talked about that. And what I was explaining to him when he asked me what was my thoughts on it. Yeah, in Baltimore, it's everywhere. It's everywhere. And I want y'all to think about the cases that are not being reported. Think about the number of people that are not going out there to get tested. Think about the people that are testing positive and they don't care about spreading it to someone else because they just upset that they contracted it, so they want to give it out to someone else as well. And it's very, very, very sad. And so what he and I was discussing in that live was, for one, no one is afraid of it anymore because it's no longer a death sentence. You can live longevity and have an extensive lifestyle on medication. So no one is afraid of it anymore because you're not dying within 6 months to a year anymore. Two, everyone is, for some reason, a condom just slipped their brains and they just think that they don't have to use a condom anymore. And like I said, I'm seeing it rapidly in the elderly community as well, because for some reason the elderly community get into those assisted livings and those nursing homes and they meeting people who's in their condominiums and they think that they just obsolete from getting it or something. I don't know. And it's just like, it's terrible out here. Plan B has Plan B. And as much as I love modern medicine and what it has done for HIV and, expanding people's lives who have been contracted, at the same time, I don't want to say normalize the disease, but it just made people extremely careless. They don't ever care that they have it because they're like, oh, I can live till 60, 70, 80. And it's pretty sad. It's pretty sad. She said it's so sad as young people. Listen, TMH is older people too. I'm telling you. I am telling you, it's older people too. She says, I heard that all the time too. Shake my head. People are doing too much. Yes, very sad. I feel like more people won't get tested then too. Yeah, because they're afraid to hear that. They're afraid to hear that they are positive. And would they really care? Would it matter to them? If they are here living promiscuous and just having fun and enjoying life, according to them, as they say. So, Anonymous, you are in my prayers. And please make sure you just take care of yourself. And anybody on this live, man, value y'all bodies, value yourselves. Because don't let some temporary fun just because you're in your 20s and 30s and teens and 40s and you thinking you young and you untouchable. Don't allow this temporary fun to affect your life longevity, because at the end of the day, as long as Lord got breath in our bodies and allow us to live to be 70, 80, 90, you're going to reach a level of maturation in your head and you're going to regret how you taken care of your body in its younger years. I've seen it so many times with a lot of my patients. They say, I wish I had taken care of myself when I was younger. I wish I didn't do this. I wish I didn't do many drugs. I wish I didn't get this surgery. I wish I didn't do this. And that's another thing. We talk about the BBL. That was one of the next questions somebody asked me. And she gave me her name, so I can say her name. But her name is Ashley Q from Chicago. She says that she got a BBL. That's what I'm going to get to next, about the BBLs. So there's another DM, you guys. She says, I recently had a BBL, and for that's a Brazilian butt lift. I'm sure everyone knows. She said, I recently got a Brazilian butt lift from a very popular doctor here in Chicago, but I started to have side effects. I got a wound infection. Oh, man. And it was not healing. I tried to heal it at home by myself. Ooh. And, oh, that's terrible. And it got worse. The skin around it got dark, so it got necrotic. And I went to the ER, and now they want to do another surgery on me. And then that's it. So I don't think she even had a question. I think she just let me know what was going on with her. Wow. So this is what I'm going to say to you. And if anybody want to comment on this, this is what I'm commenting. These BBLs, these surgeries that everybody out here just getting and running to the doctors, all because, like she said, it was popular. She went to a popular doctor in Chicago and she got her BBL, and then her wound opened up and got infected. This is what I'm going to say right here, right now. People, First of all, stop altering your bodies, especially when your body isn't even done developing. If it's not a life-threatening situation in which you absolutely need the surgery, stop altering your bodies. Because at the end of the day, these BBLs are just, what is I'm looking for? It's a trend. In 10 years, probably even still now, I know a lot of men who thought that was cute 10 years ago when they was in their 20s, they're in their 30s and 40s now, and they don't think it's cute. And because they matured. And they realize there's more to just you looking like the number 8. You big up here, small here, and then you big down here. And all I'm going to say is, I'm not judging anybody who, if that's what you feel you need to do for your insecurities, for you to elevate yourself to feel good. Hey, this is what I'm going to say for you to do then. Do your research on your physician. When I say research, I'm not meaning talking to your friends and seeing what doctor was the most popular and who did the best work and who looks the best, who looks the most natural. Look at their credentials. There was a doctor in Florida, a very popular doctor. I'm not going to say his name because I don't want to get sued. But there was a very popular doctor whose name is always everywhere, who started a course. And it was I think it was like a 6 to 8 week course where doctors, not surgeons, not plastic surgeons, where regular doctors like a dentist, like a cardiologist, a nephrologist, were doctors who specialize in other areas, not a plastic surgeon, were able to go to his course and take his course, and they paid like $12,000 for the course, you guys. And he taught them how to perform plastic surgeries the right way, and they left out of there with a certificate and was out opening up clinics and performing BBLs and doing all this plastic surgery and doing Botox injections and things like that. And so when you see a doctor who, they say, I'm a doctor and I can do this surgery, are you board certified as a plastic surgeon? So if you're one of those girls who are interested in getting your body done, do your real research. Not to see the most famous on TikTok and on Instagram and all that. Do your research and ask the important questions. Ask about his credentials. How long have you been doing this? What is your specialty? Ask them about their success rate. How many of your patients, cases were actually successful? How many of them did you have any abnormalities? Any deaths? You see what I'm saying? Any mistakes? They have to indulge this information to you. So if you just go into a doctor's office and you want to get your butt done, and he's the most popular in Chicago, I don't think that. I want you guys to be smart. I want you guys to be smart and be extremely, first of all, be self-confident and love yourself. Love yourself first and foremost. But if you're going to do it, you have to do your homework. He said, you are right, but wasting your time. They will not listen. And that's what I'm saying. So I can sit here right now and tell y'all to not get it, don't get it, don't get it, don't get it, because this is what's going to happen to your life in 10 years. This is what's going to happen in 15 years. This is how everybody's going to react to it in 40 years. And I know they still going to get it because of the social media pressure, because everybody wants to be carbon copies and look like everybody. Nobody wants to be original anymore. And so I get that they're not going to listen, which is why I'm saying the second part. If you're going to do it anyway, then do your homework. Ask those right questions. Ask them for his credentials, his or her for their credentials. Ask his or her for their case load, how long they've been doing it. What is their specialty in plastic surgery? What is your specialty? Is it breast augmentation? Is it nose augmentation? Is it butt augmentation? What is your specialty? Then you ask about his cases. How many of those 1,000 cases were actually successful without complications? You see what I'm saying? So this person from Chicago, she actually didn't ask me a question. I think she was just telling me, you know, what she's gone through or what she went through. But if you're gonna have surgery and you end up, because you're gonna have wounds, you're gonna have like draining tubes. There's gonna be wounds. If your wound starts to smell foul odorous, if your wound is starting to ooze and leak, if your wound is starting to open up, go to the hospital immediately. Do not try to treat it at home. Because right here when she said that the skin around it got black, she's talking about the tissue becoming necrotic. And necrosis means dead tissue. And now it's blackened. And that means that there's no more oxygen that can get to that particular area. So now that part of your body is no good. And so now she got to go back in and have a debridement. And a debridement is a surgery that they do to remove dead skin and remove necrotic tissues so that your skin can start healing properly once you get the dead skin out of the way. And it's excruciating. It is painful. And so you see how one surgery just to look good turned into all of this. And thank goodness she caught it when she did, and she going in for the surgery, because if she had not, yes, somebody in the comments said it is infection. It is an infection. But had she not gone, she could have contracted something called sepsis. And sepsis is a full body blood disease that will shut down all your organs in a matter of days, and then you are deceased. Deceased. Good job. What about the gym? Hey, I don't know. I don't know. Some people just not. I don't know. I love the gym personally. I love working out. I love feeling good. I love the way I sweat, because it's releasing the toxins out of my body. When you sweat and you at the gym, it's releasing the toxins from your body. You are waking up your cells. You detoxing your cells. You're kicking on your GI system. So you're promoting your GI system to work. You're promoting your heart to be healthy. So you're expanding your lungs. So you're improving your lungs. I mean, working out does a plethora of things. You're releasing a lot of toxins. So you're also increasing your serotonin and your dopamine. So you're increasing your neurovascular system. When you're working out, it's not just about muscles and a toned body. It's about muscles, toned body, strengthening the bones, strengthening the digestive system, strengthening the heart, strengthening your brain, strengthening your neurovascular, strengthening your respiratory system, strengthening your immune system. You see what I'm saying? So the gym is amazing. It's detoxing you, and it's improving your body as a whole, as an organ system. And I think that more people should do it. Like, even if you work at this once or twice a week, just go do it. Just like fat removal surgery is risky also. Yes, it is. The gastric bypass sleeve, getting liposuction, all of it is bad. And the thing about liposuction is your body is used to being, let's say you were 200 pounds, right? And your body is accustomed to surviving with you being 200 pounds. And then all of a sudden, one day, you wake up and you 172 pounds. Your body is going to freak out because it has no clue what just happened to all that fat that fast in such a short amount of time. And now it's rapidly losing weight in the next few weeks and a month because you're getting those lymphatic massages or whatever it is that you're doing. If you notice that a lot of people who have those, who do get those surgeries, they end up gaining the weight back. That is called rebound weight. Rebound weight, and I want y'all to look it up. Rebound weight is your body trying to save itself because it was not that small. It did not lose the weight gradually and safely, and so it's going to start accumulating and pocketing fat extremely fast because now I'm trying to figure out what just happened that fast to me. I need to save myself. So now you kicking on your body's defense mechanism and lymphatic system and immune system, which is the same as the lymphatic system, to try to save itself. So your body was doing pretty decent for itself at 200 pounds, and now it wake up and it's in a panic. It is in a panic. And a lot of those surgeries, where every surgery, you are at risk for blood clots. For blood clots. So you're doing yourself a disservice by getting surgery. And I had one person like, I just need to get it done, I need to get it done. And my thing is this, because you got to be realistic here. If you're going to get it done once and get it done right. That's it. Do not consistently keep going in to go get surgery every 2-3 years. You're thinking like, oh, I'm going to do this. Because what you're going to do is you're going to shut your lymphatic system down. Let me ask y'all something. Whitney Williams, and I love her. Y'all see how she has Graves' disease? Because she kept saying she went and got lipo twice and got her breast done 3-4 times and now she's sitting here at 50 and 60 and she got Graves' disease. And she has lymphedema, so the puff feet are extremely swollen. That stuff is going to catch up with you in the long run because you're breaking down your lymphatic system. You're breaking down your endocrine system because you're telling it you're putting into an auto draft in an overdraft that it wasn't designed to go through. You see what I'm saying? So you can simply lose weight and look good with diets, proper eating. And when I say diet, I hate the word diet because that sounds so like strict. Just a lifestyle change. Steven, what is the face for, Steven? What is that face for? But seriously, we gotta talk about I don't want to say diet, but do a lifestyle change. What is wrong with eating healthy? What is wrong with gardening and growing your own food? You see what I'm saying? What is wrong with eating herbs? What is wrong with going and hanging out and disconnecting from social media and going to go hang out at the beach with your friends and going bike riding and feeding birds at the park? Like, what is wrong with that? What is wrong with going jogging up the stairs? What is wrong with that? All right, you want to come up? Come on up. We got a request to come on up. All right, go ahead. Back to the basics. You want to say something?
Yes, thank you for having me. I lost 141 pounds to save my life.
Yes.
And I wasn't always obese, because that is obese. I wasn't always obese. I was small, and then I got ill at 26, and I just kept getting more medical, taking more medicines, and I have a hypothyroidism. And they found a goiter and they had to remove it. And when they removed it, I just started just blowing up. Yes. And it was more weight, it was more than like a pregnant woman.
Yeah.
And what happened is that I was concerned because I was like, I am getting overweight. So I was concerned about my heart. And people don't understand 5 and 10 pounds yo-yoing, that can affect your heart. Because then I end up having a heart doctor, and not only that, but I end up having a brain surgery. Ooh. Because I had gained. And what happens is when you gain rapid weight like that, what happens is that it produces more cerebral spinal fluid, CSF. Yeah. And my body could not rid it fast enough, so it cracked my skull.
Yes.
And then what happened is my brain herniated out of the sight, out of the skull, into the ear, and then I had to have a hearing prosthesis.
Yeah.
Because it eroded one of the 3 bones in the ear. So people don't understand that rapid weight gain like that can unalive you.
Yes, it can.
And it is so indicative of women, because what else happened to me is that I got hypertension of the brain.
Yes.
So it was a domino effect. And then just like gaining it is detrimental. Those 4, 5 pounds, 10 pounds keep yo-yoing. But that was an extreme weight. But even the yo-yoing is bad.
It is.
And so after so now I finally got my medical under control. And I was like, when I was on 14 pills. Now I'm on like 3 pills. But all of it, but that I got damaged though. That was a lot of damage that my body went through. And so I was really concerned.
Wait. Y'all give her some hearts. Y'all give her some hearts. Are y'all hearing this testimony? This lady's on testifying right now.
Give you some hearts because I'm so.
Y'all give her some hearts. Tap her screen. Give her some hearts because that is. I'm just to you. I gotta give God some. I gotta clap for that.
Well, you know what? But the caveat,
congratulations.
The caveat is that they told me, well, what they did, they tried to pitch me diet pills. Mm-hmm. And I said, I'm not eating. Well, how are you going to pitch me diet pills? Because I wasn't eating a lot. It was a thyroid that was out of whack. So all people that are overweight aren't lazy and they don't eat all the time, all day long. Yes. Some of it is contributed to medicine and medical.
Yes, that's right.
But I had a friend, she's no longer here. She passed. She had people don't, this is the ugly about it. They only tell you the pretty about it, but they don't tell you the ugly about it. I know 2 people that had stomach bypasses or whatever. Yes. And my friend, it did wonderful. She lost weight. She looked great. But as she aged, there was a problem. And the problem is people don't look at it. As you age, your body deteriorates. Mm-hmm. And you need all of that nutrition. And if you're not getting that nutrition, it's a double whammy. Yes. And so she wasn't getting the nutrition she had got to the point that she got down when she got other medical things going on with her. She got down to 80 pounds before she left here. 80 pounds. People, they're telling you about this instant gratification, but it's not good. I have another a person that I know, and she had the stomach bypass, and guess what? She is on the same weight that my friend was, out of here. So don't think that it's all glam and beauty and stuff. Yes, it will work. All these fad diets like Atkins and all of that, yeah, that work, but they're not good on the body. What happens is it's for short term, then long term, you'll see those complications later on down the line.
Correct.
And I was so glad that I didn't go for a stomach bite. And my sister was saying, I was like, don't. Let's try to do it on our own. Yes. But see, it's about that willpower and your mindset. It starts with the mind, and then it trickles down to the body. And you know, people don't understand. My journey started off with 15 minutes a day. 15 minutes a day. I started walking 15 minutes. Then I moved it up, and I did it in the morning time, 15 minutes, and then I did it in the evening time, 15 minutes. Now that was 30 minutes a day. And then after the 30 minutes a day, what I did was I eventually graduated to riding my bicycle 8 to 10 miles.
Yes.
And walking 4 to 5 miles, and that was every other day. And so I was just really dropping off weight, and people were asking me, well, the doctor was saying, well, how did you do that? And they wanted to know. And see, if I tell you how I did it, you're going to put it in a book and you're going to sell it.
That's right.
You understand what? And that's just the truth of it.
I like your transparency.
Everything's about the almighty dollar. How did you do that? And I'm gonna be honest, I have a doctor for every part of my body.
Yes.
And it started at the age of 26. So people, if you don't get it under control now, it's going to be out of control. It's going to be controlling you.
And so when you said you changed your diet, you changed your lifestyle, you went from a slew of medications, and now you're down to 3 medicines. If you don't want to get specific as to exactly what you did, but just explain to us, just briefly explain to us, what was the lifestyle change that you made?
Well, to be honest with you, I was never really a bad eater.
Right.
But I had to understand the dynamics of it, the science of it. And see, I'm self-taught. And I started this journey at 26, and it was not to learn about this stuff. It was because I had to save my life.
Yes.
And when you're trying to save your life, you'll be amazed at what you can do and what you learn. But see, you don't never want to be in that place. Like they always talk about it. The worst thing someone can tell you is when you are facing a chronic illness is, well, it's better to be proactive than reactive. And you be saying, hey, I'm please forgive me, I'm be transparent. It's like, what the hell you think I've been doing all this damn time being proactive? That's why I go to the doctor every 3 months and 4 months or whatever.
Yes.
But see, let me tell you, this is a money maker out here. They're making money off of you. And
I'm going to say this. And I'm going to elaborate more when you said being proactive and not reactive. And I applaud you for actually going to your positions and getting checked every 3 months. And like you said, you was never a bad eater. So this doesn't apply to you. But I'm just going to make this statement just in general, for the masses. Being proactive is eating healthy. Paying attention to what you put into your bodies, paying attention to your environment. Being proactive is you going out and exercising and just spending time with nature and being out there in the sun and being grounded. Being proactive is knowing your body internally. You live with yourself 24 hours a day, not the physician. So you go into the doctors and they send you for 15 minutes every 3 months, and you live with yourself every single day. So when something is abnormal, the first sign that something doesn't feel right. And it's you doing your own research and your own due diligence on what is going on with my body and how can I help put my body back in homeostasis, meaning back to normal, back in balance. How can I put myself back in balance holistically first? And I think we get away from that a lot. A lot of people don't realize that the holistic way in which our Creator, our Lord and Savior has allowed us to do is He gave us all the herbs, fruits, and vegetables we need here on earth to sustain our life and to rid ourselves of any disease process. But we've been so conditioned and programmed for the Midwestern modern way of medicine that's the first thing we do is run to the doctor and say, hey, this was going on with me. And then the doctor says, oh, that possibly could be this. Didn't do any blood work. Barely did a real head-to-toe assessment on you. And when I say a head-to-toe assessment, they're supposed to do a head-to-toe assessment, do your entire body from head to toe. They're supposed to look at your cranial nerves, check your fingers, check your mouth, check your eyes, check your ears, check your reflexes.
That's not happening.
Touch your belly, look at your buttocks. I'm not look at it, but make sure your body is properly aligned. Make sure your breast is properly aligned. Make sure that your hands are in balance. They're supposed to do a full head to toe assessment. Assess your kidneys, assess your liver, palpate it, touch it, and see if there's any like enlargement. Listen to your heart, listen to your lung sounds. When I say your heart, I mean listen to every single lub dub, every single part of your heart. They're supposed to listen to your lungs, front and back. Listen to your scope. How many of y'all on here who have had a head to assessment like that all these years? I don't know how old anyone is, but in all your days on this earth, how many of you all have actually had a head to assessment just like what I described?
I'm in my 60s, and you're absolutely right. I've never had an assessment like that.
And so my point exactly, and my point is this: they're going to assess based off of how they're gonna assess you based off your insurance, your wealth, your demographic,
and your education.
That's why I said knowledge is power. And their patient load. Because if they are there for 8 hours in a clinic and they have 37 patients, but you're supposed to spend 8 hours with a patient. You see what I'm saying? I mean, you're supposed to spend an hour each with each patient, and you're there for 8 hours, but you got 25 patients on the list. Clearly, you're not seeing 25 patients in 8 hours. You know what I'm saying? I mean, you're not seeing each patient for an hour. And so I said to say we have to be our own patient advocate, and we have to go in there and we have to speak up for ourselves. And so for you who saw yourself and you decided to take the holistic approach and the lifestyle change, and now you here testifying that your body is in a space where you're at least able to sustain a healthy lifestyle, and you've allowed yourself to have longevity by you taking that lifestyle change, and now you're decreasing your medications. That is a testimony within itself. That is amazing within itself.
I want to be very transparent. This has been a long fight because I've always had excellent insurance, and I've gone from doctor to doctor to doctor to doctor to doctor to doctor to doctor. And the reason why is because I just found out that I had two things for many years that doctors never told me. And I don't understand how I fell into that category that they did not tell me. I found out a year ago, maybe, about 2 years ago, I've been walking around here with sleep apnea. And when I went to get checked, because as you learn things, what you do is like you say, knowledge is power.
Yes, it is.
And so I started saying, let me get myself together. And so I went to have a sleep study or whatever because I was overweight. A long time ago, I've been overweight and stuff. And so when I went to sleep study, they found in my records that I had been diagnosed with sleep apnea. And I said, no, I've never been diagnosed with sleep apnea. And they said, yes, you have. I said, well, I went to a study, but he said I didn't have it. And I said, well, can you tell me, guys, your file means a lot. People document things in your file, but they may not tell you. You need to look at your medical files. And so what happened is that when I talked to the doctor and I said, no, I haven't. I said, well, what did he do? And he says, we don't see anything that anything was done. And I said, well, if I was diagnosed, you tell me, didn't nobody do anything about it?
Because, and I can answer that, and I want to be careful with what I'm about to say.
Yeah, we all got to be careful about
I'm about to say something about that, but I want to make sure that because now I'm getting ready to reveal something. This does not apply to all physicians and healthcare professionals, but insurance companies and a lot of hospital CEOs give bonuses to some physicians who falls victim to it because money talks, to not treat certain disease processes. Because now you're a test. Now you're a test subject. Now I'm curious to know, two things. And I'm talking about like rare diseases, people or rare cases, and they want to see how is the person going to be affected without treatment. So it's now you're like a test, you're like a test. Oh, I want to be careful. Now you're like a lab rat. You see what I'm saying? On top of that, if I treat you and I cure you and you no longer need me, then I'm losing money.
Exactly.
So,
and I'm gonna tell you,
I have to just say that first, and I want people to be very mindful, and I want people to really soak in what I just said. I don't want to just jump to the next thing. Really soak in what I literally just said. So I'm saying that to say this: ask for your test results. They're going to tell you that the hospital's policy is for you to go to medical records and get your records. Do not get lazy. Do not get lazy and be like, I don't feel like going to sit in medical records, and I don't feel like coming back on Tuesday for this. Go get your records. They also have something now where they put your lab results on an electronic file. And then you're able to log into that electronic file and you're able to get it. That's not everything. When I spell medical record, when you go get your medical record, you're able to see the physician's notes. You're able to see the nurse's notes. You're able to see the CNA notes. You're able to see everything. But when you log onto this portal on your phone and you log in, all that's there is lab results and new orders, you're not seeing every single thing. Right. So I encourage everyone to make sure that you go into the hospital, the clinic, wherever, and ask for your medical record. By law, they have to give it to you. Somebody said, I'm not surprised. It's been happening for years, especially with the VAs. Yes.
But host, may I hone in on that? Also, when you go do your lab,
yes.
When you do your lab work, you guys need to have a binder. Because I can tell you the onset of some of my diseases because I can track it back. And what I did was I went into the doctor's office and I would pull it off my portal prior to going to the doctor. I would look it up myself and write little notes on the side, go in and talk to my doctor and write down what she would say. And then I would put it in my binder. And I'm going to tell you, I had about 10 years of stuff up in here. I had so much of stuff up in here, it was crazy. And when I would look, and I was looking back, and I could tell you the day when certain things started going wrong with me and what she had said.
And that's what I was referring to when I was saying earlier on the live. I don't know if you was hearing us on the live earlier when I said that make sure when y'all going to these doctors, I'll make sure that you're writing everything down and bring that notebook with you to the doctor and say, hey, look, on April 5th at 10:05, I had an appointment with Dr. Hockenschnacker, and this is what I was told. And now on this date, this is what I was told. So I did speak to my attorney, and he did encourage me to ask you all for my lab results. He did encourage me to ask you all for that. So that's what I'm here for this appointment. I want this, I want that. When they see that you are documenting and you're keeping track of everything and that you're actively involved in your care, because let's face it, not a lot of us are actively involved in our own care. We go to the doctor, we say, hey, this is going on. They barely do an assessment on you, don't run any diagnostic studies, don't refer you to no specialists, and they give you a medication, and then you just go, okay, and you try it out, and then it doesn't work, and you come back 3-4 months later, and you say, hey, this isn't working. And they say, well, let's increase the dose and give you something new. You're not being a patient advocate. You're being a lab rat. You're being a test study. You see what I'm saying? And so it's like you have to be your own patient advocate. So anybody else who want to come up, you guys are welcome to come up during the conversation, because I want you all to come in, and I want you to be able to hone in on this topic and be able to express yourselves on this topic as well. So anybody who want to join, you are more than welcome to join.
There are good doctors out there. There are good doctors out there.
Yeah, come on up, Jamila.
Everything is changing now, and it, like I said, it's all about the money, but there are good doctors out there, and I have a set of good doctors, But it took me far in between to find those doctors, and you have to vet those doctors. If you feel like that doctor is not doing what you for something for you, you need to leave immediately. Because
Yes.
sometimes your morbidities or what's going on with you, you don't have that time frame to be fooling around.
Correct. Correct. You don't. Hey, Jamila, thank you for joining the conversation.
Hi.
How are you, dear? Go ahead. We're ready for you.
Okay, so I just joined probably like 1 minute ago. I was looking at the comments. Okay, so I don't even know if this is to testify or to, but I want to share something that I went through recently. Okay, so I'm 34 years old. In December, okay, let me see where to start. Let me start. All right. So in December of last year, I had got the flu, because I was going to nursing school. Like I was signing up for nursing school, and that was one of the requirements. And they were like, "Oh, one of the requirements is to get the thing for the flu." So
Yep.
honestly, I didn't think nothing of it. For the other one that was happening during 2020, I was like, definitely no, I don't care,
Yes.
whatever. But for the flu one, my friend had told me she had a bad reaction, but it was already too late. I had already did it. It was like it just happened so fast. All right, so everything was going good. I was like, I didn't notice any type of side effects. So I was kind of shocked because I hear that people be getting sick or little stuff be happening to them, but nothing didn't happen to me until I guess right when I thought that nothing was happening to me. Maybe a couple of days after that, I started to experience symptoms. My first symptom was tingling in my face. Like I felt it like in my cheekbone.
Correct.
And I was so scared because I'm like, what the heck is happening to me? And then I noticed it was tingling in my feet. I noticed it was tingling in my hands, but also my feet got very cold. I was at the grocery store and my feet had got so cold, and I was like, I started to panic. I was like, what the heck is happening to me? Something is not right. Something is not right. And that's when one day shortly after that, it felt like my whole body was shutting down.
Yes.
I felt like it felt like my heart was about to stop.
Yeah.
It was the most scariest experience ever. And I was on the phone and I was like, my spirit was like, call 911. And when I say this was the scariest, and I was like, something is happening to my body. I don't understand what's happening to my body, but I called them and I was telling my husband, I'm like, something is not right. Something is not right. Like something is really not right. And I kept feeling like something wasn't right, but mostly everybody that I had spoke to or told about it, people started to downplay my symptoms. People was telling me, oh no, you overthinking. Oh no, it's anxiety. Even when I called a paramedic, they was like, everything is normal. Your heart, everything. They was like, have you ever had a panic? I'm like, let me tell you something. Something is not right. So this was December. So when I first had that feeling of feeling like I was gonna pass out, it was in December. And then it happened to me again, probably like maybe a week later. I was at the store. I was in Michael's just shopping, regular shopping. So I started to believe what they were telling me. So I said, okay, maybe it is anxiety because they kept on telling me this. But I knew deep down inside something wasn't right.
Right.
So I went to the store one day randomly, and the thing happened to me again. Like, let me turn on my God, because like I felt like a sudden. It felt like a sudden, like, let me see if I can put my camera on. It felt like, because I want you to see my face expression, because when it's the second time it happened to me when I was in the store, it felt like my body was like,
Just
like,
shut it down.
yes. And I was like, so I'm in a store and I was looking around to see who could help me. And I was like, oh my gosh, can y'all please like call the paramedics, because I feel like I'm about to pass out. That was the way I was able to express it. So I'm like, I feel like I'm about to pass out. And they said the same thing again. The first time when I called 911, they took me to the hospital, and I know that my body wasn't right. The second time, they didn't take me to the hospital. I told them, okay, whatever. I'm gonna go, and then I went to go buy some gummies. Those blue gummies, the ashwagandha ones, the blue
Yeah,
ones.
ashwagandhas. Yep.
Yeah. So I'm thinking, okay, like maybe I need something for anxiety. But at some point, and from the beginning, I knew that something was happening to my body. And when they were asking me questions, not gonna lie, from the beginning, and they were asking me questions like, did you travel? Did you, matter of fact, this before they found the blood clots, because 5 months later, I'm gonna just skip. So after going to the doctor, to the hospital, like this went on from December, January, February, March, April,
Yes.
May. In May, it got to the point where I started having sharp shooting pains, and my body, my spirit was like, go to the hospital right now. So
Yes.
I went, and that was the day, May 7th of this year is when they did the troponin, and then it came back and it was elevated. And then that's when they were like, oh, your test came back elevated. We got to do a CT with iodine. And that's when they ran the CT with iodine. And it's so crazy because
Yes.
December is when I started having the symptoms, but January I had started nursing school. So I started learning about stuff. And as I was learning, I'm like, this sounds familiar. Like I started to learn about different testing and all of that stuff. I was doing the LPN program. So we
Yes.
kind of went straight into it. It wasn't no doing a prereqs first. It was straight into the nursing program. So, all right. So as I was learning about stuff, I just knew, like, based on what I'm learning about and based on what's happening to me, something was very, very wrong. Something was not right. So May 7th, when the test got elevated, that's when they came back and said the test was elevated. They got to do the CT. I'm looking at my husband like, okay, now they're getting to the bottom of it. And then when they did the CT and the results came back, that man came into my room and he was like, we're so sorry. Your lungs is full of clots.
Yep.
And I looked at my husband.
I was saying pulmonary embolism.
Pulmonary
embolism. Yep.
I looked at my husband because from December to May, nobody listened to me. Including family members will say, oh, you know, it's in your mind. And you know what? I was on the phone with my little sister because I'm close to her. And I said, girl, because my husband had a situation with his ex-girlfriend, right?
Yeah.
And long story short, she was young and she was having symptoms and they misdiagnosed her. Come to find out she had cancer.
Yes.
Me knowing his story and what he already went through, when something started happening to me, I was like, what if I think they're misdiagnosing me. Because they even told me I had asthma like 3 months before they found the embolism. So when they found the embolism, I was like, I was so mad because I'm like, nobody would listen to me.
They wasn't listening to you.
And so, I had over 20 blood clots.
And so you listening and you chiming in now, and I thank you for being transparent. I thank you for joining this live and sharing your story. I really appreciate it. I'm going to say this. They said she was so humble to admit that, and I listened. Yes, exactly. And I was going to say this. So you just now tuning in. So the beginning of this particular lab that we started today was talking about patient advocacy and how to be an advocate for yourself. I'm 15 years in the medical field, 3 years as a certified herbalist. And so I was telling everybody how to be a patient advocate. And one of the topics that we discussed earlier on was the fact that we are so quickly to be dismissed and unheard of just as a whole in general as a population. And because they want to be an easy fit. They want to just, let me diagnose you with this, take this medicine and go on somewhere because they want the money. They don't really want to do the hard work. Some physicians, not all. There are some great physicians out there. But for the mass majority of it, I mean, that's the medical field in a nutshell. And so as soon as you started talking about the tingling in your face, and then you said you felt the tingling in your hands, and then you said your hands, you started feeling getting cold. I automatically knew that was a circulatory issue, that was a lack of oxygen. And so when you lack oxygen, then you start having those nerve sharp pains. And then you having the lack of oxygen and shortness of breath, you feel like you're going to be fainting, fatigue. That means there's a blockage in your vessel somewhere. And so when you started to speak, I said she has an embolism. She has an embolism. And then you started talking about how you kept feeling like you was getting ready to faint. And I said, okay, my goodness, it got to be in her lungs. I was not expecting you to say 20 of them. And so for me, in my 15 years in the medical field, I want to say this to you. Be thanking God that you was one of the rare ones that survived. Because for you to have 20 clots in your lungs, 20 of them. Now I was expecting you to say 1 or 2, maybe even 5. But for you to be on this live with us today, understand you are a walking miracle. And understand that the blessing that God bestowed upon your life, for you to have 20 clots in your body and you survived. So first off, give God some praise for that. Let's give him some praise for that. That you can be on this live and talk about that.
Yeah.
Secondly, what I want to talk about is when you come to those things that they tell you have to get, your body can build up its own immunity if you take care of yourself. Somebody up there in the comments just said Yafa Shakur, and what that person is talking about is a herbal site that has remedies for viruses. They have remedies and herbs for influenza and everything, and how to strengthen your body. And that site right there, somebody else said, another doctor, I don't know who at the top said, Dr. Brown or somebody, Dr. Bobby. So I don't know about Dr. Bobby, but I know Yafa Shakur works wonders. I know it works amazingly. And like I said, the certified herbalist, I wouldn't recommend anything that I don't trust. And that site has all different kind of herbs for $10, $15, where other herbs be $30, $40, $50, and they actually work, and they help to detox and cleanse your body. So when you talk about blood clots, there are herbs and juices and teas on that site that helps with that. And when I tell you, for you to say that right now, and they told you had to get that particular thing for you to start school, that is you. If you have an allergy to eggs, if you have an allergy to chicken or any religious allergy, they cannot tell you to take any of that stuff.
They won't give me again.
No. I want you to listen. Pay attention to what I just said. If you have an allergy to eggs, if you have an allergy to chicken, and for religious purposes, they cannot force you to take anything. So I want you to keep that, put a pin in that. I just said, pin that comment. So I say that to say, for you to experience what you experience and you to be written off, that is what exactly I was saying. That's exactly the point I was making in the beginning of this live, us being our own patient advocate. They get ready to tell you have asthma. Did they refer you to any respiratory specialist? Did they do any breathing techniques on you? Any type of respiratory exams on you? But did they give you a speedometer or incentive spirometer, not a speedometer, an incentive spirometer to check your breathing? They were just ready to diagnose you with asthma without even doing any diagnostic studies. Did they run any blood work on you? The first couple times you went to the hospital and said, hey, something isn't right, they were just ready to say you was having anxiety, didn't even draw your blood work to see what was actually going on with you. And what I would say to you, by the grace of God, you here today to tell your story, but in the future, and this is for anyone who's listening on this live, if you are experiencing symptoms that is outside of your norm, that you know you live with yourself every single day, go get a second, third, or fourth opinion. I know how annoying it is to sit in the ER for 5 hours over here, and then you got to go sit in 7 hours over there. I get it. But it will be best for you to go to the ER, to another ER somewhere else, and get a second opinion, than for you to go home and then don't wake up again, never wake up again. So I thank you for sharing that. That is an amazing testimony.
May I say something to that also, please?
Yes, please. And the people in the comments, y'all can comment. I see people coming in the comments. So y'all are encouraging this young lady. Y'all are telling her about. Somebody said she is so humble to admit that, and I listen. And y'all are more than welcome to give y'all comments, as these two beautiful ladies are joining me on this live right now. So please feel free to comment. Please feel free to share. Please feel free to tap and like and heart this live if y'all are learning anything, educationally from this live.
My sister was misdiagnosed. My mom passed in 2020, and God had me to start paying attention to my sister. I'm the youngest. And I started evaluating her medications. And my sister was having some issues, and, I started focusing on her, and I was questioning those issues that she was having. My sister was doing some kind of shot because she has What does she have? It's not hypothyroidism. It's the thyroid problem that makes your eyes get very large and protrude. What thyroid problem is that?
You talking about no, it is hyperthyroidism.
Hyperthyroid, but
It is hyperthyroidism.
Hashimoto's.
Yeah,
Isn't it?
Hashimoto's. But it is
Yes,
hyperthyroidism.
it's hyperthyroidism, and so she was going getting the shot, which is very expensive, and it was going to help her eyes to go back to where they were, but there was a caveat, and the caveat is that it will bother with your blood sugar, and she already was diabetic. Now, and the place she was going to, this is why I'm not a proponent to get your blood work at the same place that you're going. The place that was giving her the shot was also doing her blood work. But my sister's blood sugar ended up 700.
Woo.
She had to go to the hospital. She was walking around here. And I don't understand, how is it that you're taking her blood sugar and you don't see that her blood sugar is high like that? Because
Now I'm gonna tell y'all like
that
this.
shot is indicative of bringing that blood sugar up.
It is, and it's because it's a steroid. So any steroid is going to increase your blood sugar. I'm just gonna say that right now. Albuterol, you have asthma, and you're taking albuterol. You're taking a nebulizer treatment. You're taking any type of bronchodilator. You're taking a corticosteroid. You're taking prednisone. Any type of steroid is going to elevate your blood sugar. An infection in your body is going to elevate your blood sugar. And so if your sister was taking those medications, they should have automatically knew to be monitoring her blood sugar.
They were
So
monitoring. That's what I was saying. You have to hear this because it was crazy. They were monitoring her blood sugar, and I was always concerned about it. And I said, that's because I said, you're diabetic. I mean, and I was really concerned. At that time, she was not on insulin,
yeah.
but later on, she would be. And see, what happened is she went into the hospital, 700. Now, I was evaluating my sister meds, and we were going through her meds prior to her going to the hospital and getting in that fix. And we were saying, well, why are you on this? And we started questioning the meds.
Right.
So what happened is she went into the hospital, and we were doing virtual, and I was over her care at that time.
Right.
And while I was talking to the doctor, she was saying, I can't move my leg. Yeah. So we were talking, and the doctor thought that she was having a stroke. It wasn't a stroke. Her leg had swollen because she had a blood clot in her leg.
Yes.
It went to her lung and gave her a embolism.
Yes.
Pulmonary embolism. But the doctor was going to write it off and give her gabapentin for neuropathy.
And gabapentin doesn't work. I'll tell you that right now. Gabapentin does not work. It's one of the most expensive medication that does absolutely nothing. If you ask me, no, I ain't gonna say that. I was gonna say something on here, but I'm gonna keep my mouth shut. But
they want to give her gabapentin.
I do want to make a point. So when we talking about these blood clots, and we talking about here, I'm gonna give y'all write this down. If y'all listen to this live, y'all write down these herbs. I want y'all to write these herbs down right now. Get y'all pen, get y'all paper, get y'all notebook, get y'all phone. Write down these herbs. I'm gonna give y'all some herbs to write down. Heart this live if y'all ready. Get y'all some pens and papers. And y'all gonna write down these herbs. And this is for y'all to detox your blood, prevent blood clots, and help your respiratory issues. All right? Y'all ready? Juniper, Juniper. Bloodroot. Lungwort. Mullein, Mullein. Stingy thistle. Greater burdock. Slippery elm. Slippery Elm, ELM. Because I'm listening to it. I'm just like, this is just terrible. And I just want to give y'all these herbs. And I usually do this when I do my labs about just medical issues as a whole. But just sitting here listening in to you all talking, I'm just like, I don't even give away herbs just on general. This will be like a general lab, but I feel it in my spirit to make sure that I say this to you all and give you all this information, okay? Because I want to make sure I help everybody out as much as I can with this on this live, okay? For those who are liking, I appreciate y'all liking. Y'all got red root down? Red root. Ashwagandha. Ashwagandha. Garlic.
That's what I do.
Garlic. That is a natural blood pressure depressant. And we already talked about beets on here. And we already talked about tomatoes. Cottonwood. Plantains. You cannot go wrong with plantains, like ever. Chamomile and angelica. I just want to just tell y'all about those few herbs because you guys have to detox and cleanse your blood. You cleanse the blood system, you detox the blood system, you detox a lot already. Dandelion root. Dandelion root is going to help to filtrate your kidneys.
Like, for example, with someone like me, that I have kidney disease.
Yeah.
I would do dandelion because I have kidney disease. Right?
Dandelion actually helps to filtrate the kidneys and open up the nephrons, and so does cilantro and parsley.
Parsley. I use parsley as a diuretic. And I use garlic. I use a tincture that I make, which is garlic and honey. And I do that every day to help with blood and respiratory.
But dandelion is supposed to actually be very beneficial for your kidneys, and so is agrimony. Agrimony is very beneficial for your kidneys. So I don't know why would dandelion be different for you, and so is chaga. Chaga is very good for the kidneys.
My doctor said, one of my doctors said to be careful with dandelion.
But you know what? You also have a lot of pre-existing issues as well. So you also have a lot of pre-existing issues. So, and you have thyroid issues as well. So your endocrine system is off in balance as well. So I want y'all to do y'all due diligence on these herbs. I want y'all to be careful on these herbs. Be careful just in life in general, not just the herbs itself, but just in the medical field. Y'all got to be your own patient advocate. And for you, Jamila, who, you just came on, you're 34 years young. Be very, very careful with this flu season because of the way your body responded. You let them know that you have severe life-threatening complications with taking certain, you be very careful with what you inject in your body. I would encourage you to detox your body now, starting now. And the reason why I'm saying to detox your body starting now is because what happens is in the summer, we, barbecuing and hanging out and enjoying a great breeze and enjoying a great summer, and we just eat how we want to eat. And then so our body is in a very acidic state. So in the winter, when the weather starts to change and our body wants to be in an alkalinic state, which means its natural state, you become more sick because now your body's trying to detox everything you've been putting in it all summer. So when you have things and you contract like the flu or anything else, it's harder for you to fight it because your body system is weakened. So I would encourage you and everybody else in this lab to start detoxing now. Cleanse your body, detox, get you some juices, get you some herbs. Stop eating the red meat. Stop drinking alcohol, drugs, red meat, eating red meats, processed foods, fast food. Just go on like a 1 week cleanse. Do your lemon water, drink your juices, drink your smoothies, and just fruits and vegetables for just a week. Just give yourself a week first and just cleanse yourself. and then slowly, go back to, eating like salads and whatever else you decide to eat before you get prepared for this winter. Vitamin C, ascorbic acid is your best friend. You get that from your lemons, your limes, your oranges, your grapefruit, things like that. So vitamin C increases significantly if you can, because I say if you can because you want to be very careful. If you like have a fracture or you have a bone issue, if you have a bone issue, you want to be careful with the amount of acid and calcium you put into your body because you don't want to develop kidney stones. So if you don't have a bone issue and you don't have a fracture anywhere, I encourage you to increase your calcium and your ascorbic acid intake starting now, because this new season is about to be something serious. We already seeing numbers rising. We already seeing a lot of cases. They're not being it's not being televised yet over the news.
Right.
Because it has to be a certain amount of numbers being reported before it can be on the news. So I am informing you all right now to start detoxing now.
And that, you know what else is out?
Your immune system now.
The big C. The COVID.
Well, you can't say that word
the big
on
C.
the live. So so Roseanne, you said what is beets good for? It's good for your blood in general. So thank you. Oh, you already answered that. You said for the blood pressure. Yep. It's good for your blood pressure and it's good for your show. I'll tell you something about beet juice. Everybody's sleeping on beet juice.
I used to
beet juice. Let me tell you something for the women. Beet juice, if it increases and purifies your blood, understand that it also is increasing circulation down to your vaginal area. So it's making you more sensitive. You're able to enjoy sexual intercourse more, and it makes it more lubricated. For men, it increases your libido. It increases your blood circulation down there more. So you enjoying sex more, better. And it can help to expand the girth. So people keep sleeping on beets, but beets has amazing benefits to it. So circulatory system, increase the circulatory system, and that's the circulatory system as a whole all throughout your body. So that's just a little fun fact for beets.
Yeah.
Anybody in the comments have any questions? Does anybody in the comments have any questions?
So with
Y'all have any comments?
With me having kidney issues, what I do is because I have to be careful of vitamin C.
That's what I was saying. Because you don't
what I do What I do is I do pineapple because of bromelain.
Yeah.
So I eat pineapple. So what I do is I make sure I get my pineapple in. So with me, I try to eat 12 servings of vegetables a day. That's what I do. And what I do is I have to watch. I don't have to watch my potassium or my phosphorus. Yeah. But I eat stuff like what I'll eat it's arugula, because arugula is lower in that. So what I do is I eat different ways with arugula. And what I don't do is I don't eat the Western diet. What I do is I know how to cook different. Like I cook Greek dishes, Thai dishes, Vietnamese.
Perfect.
So that's the way that I have to live now because of my morbidities. So I only have certain foods to eat. So I have to learn different ways in cooking those foods. But you asked me earlier and I didn't get an opportunity to tell you what I had to do is it has to be exercise as well as food together. You can have a great diet, but if you're not exercising, it's not going to do you any good. Or you can exercise and have a bad diet. They go together like a husband and a wife.
Yes.
And I had to learn that. And when I learned that, that was the way that I was able to lose 141 pounds and keep it off.
And I'm applauding you for that. Like, seriously, I definitely applaud you for that. And I'm going to piggyback off what you just said. If you guys are familiar with my page, you know I go live all the time talking about specific health issues. Like, again, I'm repeat for those who just coming on. Like, we spend one live talking about a specific topic. Like in the past, we talked about cardiovascular issues, blood pressure. We talked about reproductive issues like PCOS, fibroids, breast cancer, infertilities in men and women, and prostate cancers and breast cancer and rectal cancer. We talked about kidney issues, chronic, acute kidney stones. We talked about UTIs, sexual transmitted diseases, HIV, herpes, and we talked about holistic cures and natural remedies and cures. And so my whole point is I wanted to get through the body system first, and we talk about a lot with the body system. And then we are going to next get into talking about growing our own food, because I grow my own fruits, I grow my own vegetables and stuff. So I want to talk about different, like, you know, give y'all pointers and do labs about growing your own fruits, growing your own vegetables, how to filter your own water through wells, how to generate your own electricity. I mean, my labs, we talk about a lot of stuff here on my labs. And so if you're just now finding me, welcome to Higher Levels with Shay. If you are interested in my videos that we've done in the past, those are on my YouTube channel at Higher Levels with Shay. I am going to go live on this Monday. I don't know what topic we're going to do yet, because we did blood. We did the 4 blood types, and we did sickle cell. I do eventually want to talk about ADHD and autism. That's going to be eventually. So I will eventually talk about ADHD and autism and ADD with children, and how to help cleanse the mercury and the metal off of their brain naturally, and how to get them to focus and be able to speak, because you have verbal and nonverbal autism. So we're going to get on that live, you know, sometime like in October, and I'm pushing it to October for a reason. But we're going to talk about that in October. In the meantime, I definitely enjoy getting on here, educating and just talking and having conversations like this with you all, and just you all being open. For those who DM'd me your questions or your statements for me to read on this live, those who wanted to remain anonymous, you absolutely were anonymous. And for those who were willing to be transparent and have your identity written in a DM, I shared that as well. And anybody who on this live, if you have any topics or any questions you want me to cover and you want to be anonymous, I'm going to respect your privacy. Or if you don't mind me saying your name, I will never say your last name. I'll say like Monica P from Virginia. You see what I mean? And so we'll have those conversations and those topics. But I definitely want to keep the lab going. If y'all want to keep, you know, discussing different things, anybody in the comments have any questions about the healthcare field and the medical field, Jamila, do you have any other comments?
I have a question.
Yes.
Like with what I explained, because right now I'm still like seeing specialists. I still have to follow up with a hematologist because of my blood. I'm seeing a pulmonologist, and I'm also seeing a cardiologist. So I'm seeing 3 different specialists because they were trying to figure out what was the cause. And because my blood clots was unprovoked, they were like, that's not a good thing, because I wasn't on BC, like to prevent from being pregnant.
Exactly.
I didn't travel. Everything they asked me, I didn't have none of the risk factors. So they were so confused. They were like, this not making sense. How you got this many? And okay, so like for a while, I felt like I was normal, but then like maybe a month after that, I started to have severe, like chronic chest pain. Like the pain was like a 9-10 to the point I went to the emergency room, but they couldn't help me. So I had to follow up with a cardiologist, which I recently did a CT of the heart. Now, the last time I did a CT of the heart, the first time when they found it, they told me your heart wasn't affected, blah, blah, blah. That's a good thing. But my cardiologist who I'm seeing, he's a very good doctor. He's concerned because he's like, he's trying to get to the bottom of why I was having those chest pains.
Yes.
And my question is, because I'm not going to lie. From the beginning, when I had those symptoms, my body was telling me to go the natural route. Like I was seeking for answers outside of what was easily to access, you know, going to the store and getting something and all of that. My body, like, I just knew that I needed something that's natural. Like I felt like that's what I needed, but I didn't really know where to look. And I have a sister, because my dad is Trinidadian, right? He's not here anymore, so I promise you, if anything, I would have went straight to him like, Daddy, what should I do? But in the case, I had to go to my sister, and my sister was like, she told me about a place, and then I knew somebody else that have some stuff, but I was seeking for answers. All right, so long story short, something I kept feeling to do is detox and juice, like whatever you just said. I've been feeling to do this, but I just didn't know which way to turn. Like you said somebody got a website.
Yes, the website is www.yafashakor. That is Yafa Shakur. They do personal consultations so they can make sure that they fulfill you holistically and take care of you holistically. They have herbs on their site. They have teas that that helps to alleviate signs and symptoms of cancer, heart issues, kidney issues, liver issues. They have herbs that are so cheap, like $10, $15. They have body scrubs, soaps. I mean, it's an amazing site, and it's nurse practitioners and doctors approved. And so even some of the nurse practitioners are switching their practice, not their complete practice, but they started to incorporate holistic care into their practice. I'll say it like that. So they still practicing their specialty, but they're tapping into holistic care. And then for you, I want you to write down these circulatory. I'm going to give you some circulatory herbs. I'm going to give you some blood clotting decreasing herbs, and I'm going to give you some herbs for purifying your blood. Okay. So we talked about agrimony already. Cayenne pepper. That's a pepper, but cayenne pepper. Kudzu, Kudzu.
Okay.
Saw palmetto, SAWPALMETTO. Saw palmetto. Research lion's mane mushrooms and the benefits of lion's mane mushrooms. Look up bilberry and the benefits of bilberry, because you are so young and I hate that you're going through this. Look up did I tell you red clover already? Look up red clover and red mulberry. And this is for anybody who's trying to just purify your blood clots. And then she talked about chest pains. And for chest pain, there's this herb called Anise hyssop, ANISE hyssop, HYSSOP. And if you go to that site, Yafa Shakur, YAFASHAKOOR, they have a tea that has like 8 or 9 different herbs in it to help with just to strengthen your cardiovascular system as a whole. But then they also have individual herb packages just in case you want to like make tinctures with your herbs or make tea with your herbs, just your own, do it yourself. So that's completely up to you, okay? And we already talked about stingy nettle, but also look up hawthorn, HAWTHORN. Somebody said, Yisrael, yes. We are talking about health and wellness and just being a patient advocate for yourself. Welcome, my brother. We welcome you. And we have 2 beautiful souls here on the line who's being very transparent. We also went over some questions that people, feel comfortable with DMing me just about their overall health and just life in general. You said, what's the name of the site? The site is Yafa Shakur. YAFASHAKOOR. And they deliver and they do consultations. So if you want a consultation, they'll do a consultation. And somebody told me about another site, and I don't mind mentioning it, but I haven't tried their products yet. So I don't want to be on here telling y'all to try a site and then y'all get scammed or something. You know what I mean? So I'd rather tell y'all about a site that I know for a fact works. Like I said, I've been in an herbalist for the past 3 years. Monica say slow down. Okay, it's YAFASHAKOOR. Yafa Shakur. And if you have children who has ADHD, autism, they have stuff for your kids as well. Thank you, Jamila, for putting it in the comments. I wish I could pin it, but let's see. I don't know why they won't let me pin it. Are you able to pin it, Jamila? Because they won't let me pin it for some reason.
No, I can't.
Okay. But thank y'all for the hearts. If y'all learning anything from this live, I get on here for free. I don't charge anybody for anything. This is 15 years in the medical field that I'm just giving y'all because I love my people. I just love people, and I want you all to have a real chance, a real genuine chance at sustaining your life. And when you go into the doctor's office, how to be a patient advocate, because to be completely transparent with you, I just see it getting worse. I just see it getting worse, and it's going to get worse, and it's going to get worse, and it's going to get worse. And that's why you have to not only educate yourself on your body, but educate yourself on from the medicinal standpoint and herbal standpoint, and really, really, really think about gardening and growing your own food, growing your own medicines, growing your own fruits and vegetables, being out there in that sun, being grounded. We talked about the importance of the sun and how it helps your endocrine system and your digestive system and your blood and breaks down your cholesterol. And I mean, the sun is absolutely amazing. And so I don't get on here for anything. If you give me a rose, I would like a rose. If you give me a flaming hot, what is it, a jalapeno, and that I appreciate it, but I don't get on here asking for anything. I just get on here and ask y'all to just join my lives, you know, and listen to what I'm saying to you, read between the lines of what I'm saying to you, and just be focused and do what you have to do for yourself, and pass the message on to someone else. Invite them to the lives. I'm going to take this live and I'm going to post it to my YouTube channel. So if you just now tuning in, or you want to see my previous lives, then go to my YouTube channel at Higher Levels with Shay. Follow me on Facebook at Higher Levels with Shay. I have my own radio morning show at 10 a.m. on Mondays at KPTV and KP Radio at Higher Levels Shay Morning Show. So, and on that show, we talk about grants. We talk about business and how to build your business, how to build generational wealth and trust funds. And we have special guests coming on that helps. I have a man by the name of Brandon, Mr. Finance, Brandon, who's going to be on. And he talks about how he can help you get building for your business and how he can help you be a millionaire. So it'll be exciting to have him and interview him on a radio show on Monday. Not this Monday, but it's an upcoming Monday. This Monday, I have somebody else, Dr. Deborah, who's going to be on. And she's an amazing person and very successful in her businesses. And she's going to give us some business gems and everything. So I'm getting on here because I feel like it's the right thing to do. It's just the right thing to do. And the more we know how to take care of ourselves, the better chance we have at life. And it's not to, I love the medical field, you know, the good part of it. And so I'm not like telling people to run away from it. It's just that just expand your options. Know that there are other options. And if you do decide to go to the medical field, know how to utilize it to your advantage. Don't just go in there being a lab rat. Don't just go in there being a test subject. If you're going to go there, know how to use it to your advantage. Know how to get the greatest use of it and maximize it for your health. So that's the whole point of these lives. Jamila, somebody in the comment had a question for you.
Yes.
Oh, Monica, thank you for following. You said you follow me. Thank you for following. I appreciate y'all following. I'm going to go on live Monday. I know that's Labor Day. You might be barbecuing with your family. But I'll keep it brief because I know it's a holiday. But I'll go live on Monday. I don't know what topic to do yet, but it'll come to me. But somebody did have a question for you, Jamila. They said, does she go through a lot of sadness and grief?
I do.
I guess dealing with what you're going through. Yeah. That's a great question. Is real?
Yes. Because my whole life changed. Like I said before, I was healthy. I'm talking about in every area of my body. I never had any issues with anything. And like nothing with my blood, nothing with my lungs, nothing with my eyes, nothing with my muscles. And when this stuff started happening to me, it's like, to be honest with you, I started getting the symptoms like I couldn't breathe, I was out of breath. But when I say so many things was happening in my body. Even my muscle, I was having muscle pains, muscle spasms.
Yes.
Like even after getting the surgery, and some days I would just sometimes like I think it was yesterday, and I was telling my husband like I feel like I'm like I'm tired. I told him I'm tired because I just wish that like I would have never thought that from how my life was before, I would have never thought in 2 more years you're going to be going through it. Like I would have never
Yes.
thought. And when I look back at my life and how my body feel right now, it feels so unreal.
May I say something? What I'm learning and what I have learned is the way you think means everything. If you think negative energy, sickness is a negative energy. And if you think negative, it will manifest inside the body. Like I said, I have a doctor for every part of my body, and people look at me and they can't believe it because I don't think that way. Because your mind controls everything. So, look at the little wins.
Yeah.
And the little win is they found out and they're looking for it and they caught.
Yeah.
Because see, there didn't have to be any little wins. But when you start having those little wins add up to big wins.
Yeah.
So you have all the reason to be grateful, to be happy, and not to be sad, miserable, gloom, and doom.
Jamila, that was a reason for me to be on this live tonight. I was not about to get on this live tonight. I was exhausted. I'd have been out all day. We done went to event after event after event. And I was like, I'm getting ready to wash my face and go lay down. But the Lord just told me to get on live. And I was like, okay, I'm going to get on for 20 minutes. And that's all I was going to give myself was 20 minutes. And I'll do it for 20, 30 minutes. I'll answer a few questions. So I literally went through my DMs and I got a lot of questions and stuff in my DMs, but I pulled only 5 because I was like, I'm only going to answer these 5 questions. I'm going to get on it for 20 minutes. But now I understand the reason why I was supposed to get on this live, and it was to hear both of you all's testimony, and specifically for you. And this is what I'm going to say for you, because what she just said, and thank you for your comments, Terry, I appreciate it, was it all starts with the mind. And so right now you're tired and you tell yourself like, man, I'm tired, and it's bringing you down, make you feel sad. When in reality, I want you to switch that up and start saying, man, I'm tired and I'm ready to do something about it. I'm tired. I'm tired of being a victim. Now I'm ready to be a victor. It's time for me to take my power back. It's time for me to get my life back. Because at the end of the day, if you got it, if you call something, there's a cure for it. I always say that if there was a cause for your demise, or not your demise, I'm sorry. If there was a cause for your diagnosis, then there's a cure for your diagnosis. And what I will tell you is do exactly what it is I was telling you to do. Do your research though, because I don't know your full medical diagnosis, nor do I know your allergies. So do your research on those herbs that I was telling you about. What I also want you to do is to look up chamomile and lavender. Lavender is a natural anti-anxiety and antidepressant. You're also going to get as much sun as your body can tolerate, because see, I don't know if you have any autoimmune disease. I don't know if you have skin issues. But get as much sun as your body can tolerate. That sun is going to increase your serotonin and your dopamine. Do you get what I'm saying? And those are your happy hormones in your body. It makes you focus more and it makes you happy. And I want you to do that. You can also get mint and put mint, like real mint, and like put and dip it in rubbing alcohol and put it on your body. It's extremely soothing for your muscles, for any muscle aches. Now I'm telling you the natural way. Everybody know they can go get beer and aspirin cream and all this crap, but we trying to treat your body right now. You see what I'm saying? And so you spend some time with God. Thank him, thank him, thank him. Because 20 clots, that's still blowing my man right now. And you be grateful. Another thing I want to tell you to stay away from right now, stay away from vitamin K. Put that down.
It thickens the blood.
Stay away from vitamin K. Vitamin K is a natural blood clot entity of a mineral. So let's say you having bloody noses and you need vitamin K. Foods that are rich in vitamin K are things like spinach, greens,
Brassicas,
kale, broccoli. You see what I'm saying? So when you, somebody say all of the brassicas, yes, all of the brassicas. So when you do your research on these foods, you able to decipher when to use it. So I would tell somebody who's having like blood clots or their blood was always super thin, I would tell them to eat a lot of spinach, eat vitamin K so you can clot your blood, you can thicken your blood. You, on the other hand, you have blood clots. You need to stay away from vitamin K. So look up vitamin K rich foods and you stay away from those foods. And then Google blood thickening foods. Any foods on that list, you stay away from. Eat your water, meaning eat your melons, your cucumbers, your watermelons, your honeydew melons, your cantaloupes. Stay and drink natural spring water. Natural spring water, to be exact. And you're going to do those detoxes, and you go on that website and get that. It's a tea called Clean and Lean, or something like that. Lean and Slim, something. Whatever you slim and lean and you mean, I don't know. But whatever it is on the website, you get that detox tea and you start your detoxing. I told you already to start detox, start cleansing now. I didn't know why I was saying it, but the more I'm talking to you, the more I understand why I was on this live. I was specifically on this live for you. Okay. So it's so funny because I was about to ready to end it, then you popped up, and I was getting ready to get off shortly. And so I need you to do exactly what it is I'm telling you to do. But research all those herbs, research it first, and make sure that it is conducive for your health and your overall health. If you are pregnant or breastfeeding, do your research on those herbs with something, because a couple of those herbs can cause a miscarriage. So do your research on those herbs, okay?
Okay, so the first list that you gave us, it was for the juniper, bloodroot,
yes,
lungwort, mullein. This list is for what?
That whole list was for the respiratory system and for the blood clots. So that was the cleansing of the blood and the blood clots. I think that was the second list I gave you. The actual first list I gave you was the detox list. It was just to detox your blood as a whole, detox your system as a whole. Then that second list that I gave y'all was for the respiratory system, kidney filtration, and your blood. And then I just gave you a few other, or the last list was for just your heart in general, how to decrease blood clots, angina, meaning chest pain, and cleansing your blood.
Yes, the one that said the cayenne pepper, kudzu, saw palmetto, lion's mushroom. This one is for the heart, the chest pains.
Yes.
Okay. So the anise hyssop is on this website.
The anise hyssop, that's for angina, that's for chest pain. That helps to alleviate chest pain. Somebody said, what would you recommend as a good spring water? Now, this water is a little expensive, but I like it. Do you know that water, Eternal? It comes in a funny shaped blue bottle, like a funny shaped blue bottle. I like that water. I really like that water. And there's another one called Ice Glacier, and it looks like a broken mountain. That bottle is really cute. Yes. But I like those waters. I like Ice Glacier, and I like Eternal.
Yes, me too.
See, so those are some ones that I will recommend. I don't recommend like Ice Mountain and all that stuff. And read the back of y'all water label. Y'all get your water bottles, read the back of them, because if they contain even just a little amount of sodium, that's not good water, because sodium dehydrates you. And so while you're drinking the water, you're going to want it even more. So it's kind of like a money grab. So you're going to always be thirsty and you're never going to be replenished. You know what I mean? So you're welcome, Nene. Nene said thank you.
What I wanted to say is that a lot of people, we talk about different blood disorders and stuff, but they never talk about alpha thalassemia or beta thalassemia. And I was anemic, and I had been searching for many years to find out why. Because, like I said, I've always been a good eater. I've always eaten lots of vegetables, salads when I was young. But I had to take iron. It's like, well, why have to take iron when I eat so well?
What's your blood type? Are you AB?
No. Me?
Yeah.
Oh,
I'm anemic too, and I'm positive. and you're telling me why.
No, I'm O positive. But what I learned, I went from doctor to doctor, but then I went to a renowned place and I had tests ran on me and I learned that I was alpha thalassemia. And a lot of people have, and I have a trait. A lot of people have alpha thalassemia and it is African Americans because there's no way that you should be anemic if you're eating, because a lot of us eat collard greens. There's people eat collard, we eat collard greens every weekend, especially if you're in the South, and the brassica families, and that is with the vitamin K and the thickening of the blood, the building of the blood and the iron and stuff like that. So with that being said, what I was doing is trying to find out why. And the doctor would say, well, some people just don't metabolize iron that well. And I kept saying, why? And so when I found out, I tested and I was alpha thalassemia, and I found out a lot of African American people suffer from anemia. And if you're a man, most definitely you shouldn't be suffering from anemia because you don't have a mix.
Right.
And so when I found that out, I found out why. And see, people don't understand when you have anemia, and this is so important that I want to get out, you need to do something about it. Because anemia causes you to not get blood to your organs.
That's true.
And if your kidneys is not getting the blood that it needs, guess what? Could that be some of the problem in the African American community? That everybody walking around anemic and stuff, and their kidneys are taking a hit?
And that's the thing. I feel like everybody needs to know their blood type. I don't know if you was on my live when we talked about the 4 blood types, and we also talked about sickle cell anemia and sickle cell disease. And so, I'm sorry. Oh, is she okay? Oh, they getting her. And so, basically, it's a genetic disease and it's a rare disease. And I was telling them to make sure that they make sure that you all know your blood type and you do your genetic testing. Find out exactly what it is, what's your genetic mark, your genetic makeup, what runs in your family, because that is extremely important. And you'll be surprised how many people don't even know their blood type, nor do they know what genetic disorders runs in their family. And I encourage everybody to know that it's extremely important, especially if you're considering having children. So you need to know what's your blood type. You need to know what's your genetic makeup as well as your partner's, because that definitely will affect your children in the long run and your grandchildren.
And what it is with alpha thalassemia, I only have a trait that it could affect you to have. If it wasn't a trait, I could have been having miscarriage. My children could have had deformities, different issues and stuff like that. But it was, and see, sometimes we're having things and we haven't been told, and that's very important. So if anybody out there, African American, anybody, if you got anemia, you need to take care of that. That is something very serious. You're pregnant, you having children, it can affect your children, being anemic and stuff. You want to find out.
And you may need blood transfusion. It's a lot. It's a lot.
I'm anemia. And this is the thing is, they're doing testing with my blood.
I can't find the website for the products. Which web did you Google? It's yafashakur.com. www.yafashakur.com. YAFASHAKOOR.com.
Is that 2 African American guys? I think they're on TikTok as well.
You know what? I don't know, but I do know. Wait, are they nurse practitioners and doctors?
I think they're on TikTok. Yeah, I think they're on TikTok, and they talk about food and different roots and stuff like that. I think I saw something like that. I think I'm following them. So they may be on TikTok. Well,
make sure you subscribe to the website, because they now have sea moss and sea moss jam. And let me tell y'all about sea moss. If y'all don't know about sea moss, and it has over 95%, it's 95 of our phytonutrients that we need in our bodies. So literally taking sea moss and adding it to your tea or adding it to however you plan on preparing your sea moss, or the jam, you can add the jam to like your bread in the morning or your bagels. Just eating sea moss alone, you taking a multivitamin, a super multivitamin, without actually taking the synthetic product. So I don't know if that's them or not, but I do know that they have sea moss jam on their site. And the sea moss is good.
I think I did see them. I think they're on TikTok. But that's another thing. But with me, and people realize I don't do a lot. I do herbs, but I grow my own food. I
Yes,
grow my own food,
it's so
and
important.
I make my own fertilizer. I make
Yes.
my own fertilizer. I grow my own food. I amend my own fertilizer. So, and I have taken classes to learn how to do that.
Mm-hmm.
For like buying a lot of stuff from the grocery store, there's a lot of recalls out there, and
Yes.
people, you need to get notifications from FDA. You need to get notifications from them, the Food and Department Administration, because I get
If you plan on selling the foods and stuff, then yeah, but you can grow your own food. You don't need an
no,
FDA
well,
food to grow your own food.
no. I'm not finished. You need that to get notifications because there's so many recalls out there.
Yeah.
There's a lot of recalls out there. So, and I'm in a science community. So I get my notifications from the science community and FDA because there was so many recalls out there. With me having morbidities, it put me at risk. So what I have developed is I only go to one store, two stores, and that company, up under the company, those stores, those chain stores.
Yes.
Like, for example, like I don't know if you have a Publix where you are or something like that. I only go to a Publix. So if there's any recalls, and if it's not at a Publix, guess what? It doesn't concern me. But when you start getting in trouble in this climate right here is when you go from store to store to store to store to store picking up
Trying to
stuff.
figure it out. That's why you got to just stick to what you know. Stick to a source that you trust.
Right.
And don't play around with your health. And that's what I was saying earlier when somebody was asking me about another website. I haven't tried it out yet, so I'm not going to sit up here and tell y'all to go, oh, try this site out and this site and that site. I'm not going to just name sites just because they're online or because they're in the local area. You know what I mean? And I haven't done my research on it. I have done my due diligence and
Yeah.
really, vetted them out. And so if you go to like a Whole Foods or you go to a Publix or
Right.
you go to your local farmer's market and you know that you've consumed their food and you had no issues with it and you got a lot of beneficial, outcomes with it, stick with it. Just stick with it. And so
Because
I will say that much. And that's why I encourage everybody to please just really tap into growing your own food, tap into just researching how to, like you just said, you said that you make your own fertilizer. So, get you some soil. All of those kitchen scraps, they're not scraps. Like your banana peels is full of potassium and it's really, really great for your garden. Eggshells is full of calcium. It's really great for your garden. Apple cores, things like that is really good for your compost. For compost, they can really, really, really great nutritional compost for your garden. And so these are some things that we definitely going to be talking about when we are digging deeper into these labs. And that's why I tell people just follow me and if you look at my page say my page so random, just be ready to learn because I know so much. I know a lot. And I'll be liable to come here and tell you how to light a light bulb from scratch, which that's going to be a lab as well. We're going to get a potato, a lemon, some wires, a bulb, and I'm going to show y'all how to connect the wires to conduct electricity and light your light bulb. So when I say join my page, be ready to learn, and it's going to be random, that is exactly what I mean. We're going to do some science. We're going to do some gardening and agriculture. We're going to do some medical moments. We're going to be on here praying and giving testimony. I do prayers at 6 a.m. in the morning. So it's random, but it's necessary, okay? It is absolutely necessary. Does anybody else have any questions? Because I'm going to be getting off here. I think I've done this for like 2 hours now.
Shay, what I want to find out is that when I first went on this journey and I had to
Well,
learn.
give me a second. I'm getting ready to get out, so I want to give somebody else a chance to. They have any questions or comments?
I'll write it.
Yeah,
Right.
type it in the section. Does anybody else have any questions or comments? I would love to keep talking to you, but I've been up about 2 hours and I got to get to the baby.
Yeah.
Does anybody have any questions? Everybody just learn. Thank y'all for the hearts. Thank y'all for the shares. Thank y'all for sticking with me for 2 hours. I know I've been seeing people coming and going, and I just appreciate y'all for sticking in here. How to read labs. Hey, that's a good lab to go over. I didn't think about that. All right, back to the basics. Come on, love. Well, you know what? That's a good lab to do. And we just kind of go over like the basic labs. I know you can't do like every single lab ever, but I would love to go over like CBCs and CMPs and your RBCs, WBCs, and what that looks like, and your cholesterol, liver panel, renal function panels, EKGs. No, that's too much. I don't do EKG. That's too much. We'll do that. Listen, EKGs, hearts, and like CT scans, those things, we gonna say this for one big lab because that's like more critical, diagnostic studies. So let's do the basic labs first. So you know what? That's a great question, my sister. We'll do that then. We'll do labs. Y'all want to do labs on Tuesday? Just go over labs, how to read labs, how to interpret labs.
The reason why I was saying that is because that was the basis of me helping myself, is to learn how to read the labs. Because when I didn't know how to read the labs, because I formed my diet to my labs.
Yes. Potassium, magnesium, sodium, phosphate, phosphorus. All of those are extremely important when you are reading your labs, looking at your electrolyte levels, looking at your platelets, looking at your hemoglobin levels. Normal levels, yes, talking about the normal, what's normal, what's abnormal. When we talk the labs, I'm gonna do that on Monday. That'll be a great follow-up from this one, because this one we talk about being a patient advocate. And so the next one we absolutely can talk about labs. Now, you're gonna be a patient advocate. How do you know how to read your labs? How do you trust it? So, what is you ain't got to tell me your full name, but what would you like to be called? Or do you want me to call you back to the basics?
Yes.
All right. Okay. So that's what we'll do, back to the basics. We'll go over labs. No worries. Well, I love y'all. Thank y'all for tuning in with me.
Monday on YouTube or here?
Monday at 10 a.m. Central Standard Time, I will be on Kingdom Purpose Radio, KPTV. I'll still be going live on YouTube. So it's going to be on YouTube, but it's going to be I'm going to be going live from the studio, well, this studio, but I'll be doing it on the radio. But I'll also be doing it on YouTube. So at 10 a.m., follow my YouTube channel and join my lab. My YouTube channel is Higher Levels with Shay. Higher Levels with Shay on YouTube. And look at those old videos. They are very, 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 very informative. A lot of great gems on those old videos. I'll be going live about this topic, about how to interpret labs. So if that's at 10 a.m., how about we do it? I want to say do it early, like 3 p.m. instead of this late at night. We could do it early, like 3 p.m. 3 p.m. Central Standard Time. That way, everybody go like 2 or 3 o'clock. That way, everyone can still have time to go enjoy barbecues and be with their families. And we just spend an hour and a half just kind of going over labs and interpreting labs. So let's do 10 a.m. on YouTube, and then we'll do 2 p.m. here on labs and how to interpret labs. How does that sound, guys? Sounds good? All right. Well, I love you all. Thank y'all, and y'all have a blessed night. I'm gonna end it with a good prayer, and I just ask Father God to continue to cover the sick and the shut in. Father God, unveil the eyes of those who cannot hear and do not see. God, allow the nation to know their purpose. Understand that you don't have them here for no reason, that you have a post in their body and it's for a purpose. Give them the strength and the wisdom to know that they are enough. Give them the strength and the wisdom to know that they can defeat that anxiety, defeat that depression, defeat these illnesses, and defeat all things that are holding them back and causing any form of self-esteem issues in their bodies. Give them the wisdom to know that they are powerful. Give them wisdom to know that you have them here for a reason. And I thank you for utilizing me. I thank you for using me as a vessel to continue to do your work and to continue to anoint others. And we love you in Jesus' name. Amen. 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 God bless you. Have a good night.
Good night.